London was identified as being several weeks ahead of anywhere else in the country, which puts us much nearer to where Italy has been. And the fear is simply our health system cannot cope. Can you give any reassurance to people that London is ready for what people believe is now coming?
Well, good morning. I've been asking for some weeks now to attend Cobra, not for vanity, but because I think it's important for the mayor of this global city to be around the table, making decisions about what happens going forward. For the first time yesterday afternoon, we received a call from Downing Street inviting me for the first time to Cobra. And I turned up and was told by the government and the government's advisors that London is a few weeks ahead of the rest of the country. And the way this virus is spreading is faster than the government and advisors had thought. Where we are now, Piers, is we've had in London 23 people who've lost their lives already. We have around a quarter of those who have been tested around the country, and you'll be aware of the concerns about not enough testing in London. And actually, we can understand why London's further ahead than the rest of the country because of our connectivity, our global travel, our density. So you're right, it's a bit superfluous now to argue about why we weren't there before around the table, why we weren't taking part in decisions. I'm there now. What I can tell your viewers is I think the advice from the government and the experts now is the right advice. We've got to take sensible steps to avoid this virus spreading faster. But what we've got to be live to is the fact that there are certain parts of our community, if they catch the virus, it is really, really serious. And you've been talking about this morning. Those who are pregnant, those who are above the age of 70, but also those with underlying health conditions, that makes it really tricky. And so people will see pubs, restaurants, theatres not opening because of lack of business.
It's a big question.
Can I just say on that note, because is there enough clarity, Sadiq Khan? You know, yesterday we were hearing people are being told they shouldn't go to pubs, clubs, bars and restaurants, yet it wasn't announced that those pubs, clubs, bars and restaurants, theatres should be closing. Now, a number of them have chosen to do so, but do you think there should be more clarity on this, that there should be a blanket closure of all places to avoid any further transmission?
So after leaving Cobra, I chaired a meeting in City Hall with businesses across London, and one of the biggest concerns is the lack of clarity. We've had now bold action to address people's health. We need bold actions to address people's livelihoods. So, for example, what I'm being told by theatres, by pubs, by restaurants, is because this isn't a ban, it's advisory, they can't claim on insurance. So what the government's going to do is one of two things, either clarify and confirm it's a ban so these businesses can claim for insurance, or make sure these businesses are given some help, whether that's cash flow issues, help with rates, with rent, with charges. What I'm being told is many of these businesses rely upon cash flow to pay wages. Even a week's lack of business means they can't pay wages, which means laying people off. It doesn't make sense to me to increase the benefit pool later on. What the government should be doing now is the things that Macron's doing, the things that Trudeau's doing, the things that Merkel's doing now.
Yeah, I totally agree. On the pressing issue is people's health. You know, we'll have to work out the economic stuff, and it's hugely important that we get this clarification. I hope the government announces it today that all these places should shut down so there's clarity. If you're going to shut them down, order it, and let's all be clear about what's going on. This kind of, I'm suggesting, and you can make your own minds up, seems to me highly dangerous in an environment like this. But the more pressing question for me, Mr. Mayor, is this. Are London's hospitals, which are about to become the epicentre of this attack by this virus, in this war, are they going to be able to cope? And the particular question, do they have enough ventilators, given that we know a high percentage of the elderly who are most at risk here will need ventilation if they get put into hospitals?
Well, the short answer is no. That's one of the reasons why the government's strategy was contain and delay, to get us as near as possible to spring and summer, to free up capacity in the NHS. What we do know is because there's no vaccination, no antiviral treatment, often when people have underlying health issues or are elderly, ventilators is what we need. And that's one of the reasons why we've been delaying, the government has been delaying until spring and summer. Roughly speaking, the calculations from the experts are of those who get this virus, between 5 and 10%, maybe 15%, would need a ventilator. At the moment, the NHS hasn't got the capacity, what the government's been trying to do is to ask businesses who make ventilators or others who've got the expertise to switch to make the ventilators. The key thing is, if anybody is feeling unwell and has underlying health condition, to ring 999 or 111 and get the assistance they need. Can I just do one thing you said, Piers, which is really important? You're right to focus on health. My concern about the lack of support for businesses is people may, for understandable reasons, choose to work to put food on the table rather than self-isolating. So if you are working in the gig economy, if you are self-employed, if you get a low wage or on zero-hour contracts, you may have somebody in your family who's got a persistent cough or has a temperature, or you yourself may feel iffy, but you realise unless you're working, you can't put food on the table. And that's why we need government support now, because protecting livelihoods protects health.
I totally agree with you. What about the issue about schools, though? London schools at the moment are being kept open. I'm getting so many people, teachers saying, my health matters. Why am I being put into a situation where I'm almost guaranteed to get infected and then maybe take it back to my family? You've got parents taking their kids out of school. I know that my daughter goes to a French school. All the French schools have locked down. They've sent all the kids home now. But most London schools remain open. Many teachers won't be there. So what quality of teaching will people be getting anyway? And what is the logic behind saying we don't want people gathering in large numbers, but still having a situation where twice a day, hundreds of parents and nannies all congregate with many kids who will be probably carrying this without much of a problem, but may then be infecting the adults?
This was raised a number of times without breaching confidences at Cobra yesterday, and the advice is that it makes very little clinical difference in relation to closing schools, but that advice may change in relation to what we do know is some teachers may be pregnant, others may have underlying health issues, a child may have a persistent cough or a temperature, which means mum, dad, carer decides to withdraw the child. We're approaching Easter, which is still about 2 weeks away for most schools and school holidays, but I wouldn't be surprised if over the course of the 2 weeks before Easter, government advice changes. But the government advice for the
provision, Mr. Mayor, for this, which is if they have to close the schools tomorrow, right, which they might, the way things are moving. It's moving so fast. Most other countries have now shut down schools. I saw a piece in one of the papers today. We're almost the only country now in Europe which is keeping schools open. Is there a provision for the children of healthcare workers to be treated differently to the rest of the populace to allow their parents who work in the healthcare system to go to work? There is in other countries.
Yeah, the two issues there that were discussed. One is for those essential workers who, frankly speaking, we'd rather they be working in the front line than looking after their children or having grandparents look after the children. Can there be provision in relation to them still being in school? But also those who receive free school meals. We know that actually often the lunchtime meal they receive in school is probably the only wholesome meal they receive. That's really important for them. The other issue, which is really, really important, is if it's the case that the tests are being rationed, can we make sure we triage so NHS workers, those in the front line, are being tested to make sure they're not, for the sake of safety, taking themselves to the front line to self-isolate when actually there's no reason why they shouldn't be working if they've been tested?
On the situation on public transport, I know we spoke to you at the beginning of the month, didn't we? You said then there was no risk in using the tube or the buses, but obviously that advice has changed. We're being asked to avoid all non-essential travel. What's happening with the public transport in London? Is there a massive scaling back? Is it closed? What's the current situation?
Well, can I just distinguish two things? One is whether it's safe to use public transport. Two, not to use public transport because we don't want to gather socially. It's really important to distinguish the two. We in London enhanced our cleaning regime. We were now using the antiviral, antibacterial disinfectant used in hospitals. What's changed, though, is the advice yesterday from government. The advice basically is not to gather socially, whether it's in pubs, restaurants or theatres. Most of us who use the tube will know in a carriage you have between 1,800 people. On a bus you can have between 60 and 80 people. On a platform you can have 100 people. So the advice is not to travel on public transport unless it's essential. We're keeping it running. Today's a normal service because many nurses, doctors, police officers, firefighters and others, those who work in your studio, may need to use public transport to get to work. We're going to review that. What we may do over the course of the next few days is go to a Saturday or Sunday service during the week and then maybe even scale that down even more over the course of the next few days and weeks.